Hi, everybody. Welcome to today's video. My name is Dre, and I am a healthcare IT consultant and the founder of Draegan Consulting. And today I want to chat a bit about workflow documentation and specifically what some of the benefits are to documenting our workflows. So in general, documenting workflows and business processes have huge benefits for organizations, and that includes healthcare organizations. So they are often a foundation for many other activities that we're going to embark upon. But one of the things that I want to make clear is that documenting your workflows is a lot of work. And I don't just mean it's a lot of work to get things going at the beginning. I mean, it's a lot of work also to keep them up. So if you're a consultant in the industry or you're a member of your IT department and you're trying to encourage people to assist with the collaborative work to document workflows, having some of the benefits top of mind might be helpful to convince some of those who are a little apprehensive of the workload to try to get things done. Definitely worth it. So I don't want to scare anyone off, but I also don't want to make it seem like it's super simple. So if workflows are documented and kept up to date, they can reduce the efforts for a number of other initiatives in your organization significantly. So it's one of those endeavors that's going to be an upfront effort. So it will seem like a lot of work at the beginning, and it is sort of upkeep, continual upkeep, but it's going to save you an enormous amount of work on the back end. So definitely worth the effort. So let's jump in and talk about the 10 benefits that I think come out of documenting workflows for a healthcare organization. So first up, we've got role definition. So when you're documenting workflow, it's necessary that you define the roles, so the individual roles, as well as the systems that are participating in the process. So often these are referred to as actors on the workflow documentation. But it's important that you identify sort of who is actually participating and at what phase, which can be very beneficial just to understand sort of how it all works and where people are. The second one is clarity. So having a process documented reduces confusion and ambiguity across the organization. So if you have something that you can utilize and something that you can reference, it's a lot easier to explain how things work. It's a lot easier for new staff coming on or for individuals who may not participate in a particular process very often. So if it's something that they don't do on a regular basis, that it's sort of a one-off or an infrequent activity, having a workflow documented can be very helpful for them to reference. Third, training materials. So developing training materials and support materials overall can be much easier if there's a documented process that you can actually use to reference in the creation of those documents. So one of the things that documenting workflows helps you to do is to create scenario-based training or scenario-based sort of how-to tips and tricks, which greatly improve the ability for the recipients to digest the information and actually internalize it. So if they can put it into context and understand sort of what it is, where it fits, and how it will incorporate into a flow, it's a lot easier than if it's just a straight functionality discussion. So they can be very helpful in the creation of training materials. So the next one is bottlenecks. So if you have a workflow documented and you can see the pieces and the parts and the different actors that are participating, once you have that laid out in a visual or a written format, it can be easier to spot bottlenecks in the process. So to see sort of where there may be issues, where the flow might get constricted and where a lineup of things is happening. So that's difficult to find if you're just having general conversations and you don't have something to actually tangibly look at. The fifth one is duplication and automation. So similar to how you can find bottlenecks, if you can visually see something, especially one that's incorporating your IT application. So that isn't just incorporating sort of staff movement or general, flow from a physical perspective, but that's incorporating systems. It can help you see where duplication is occurring with data entry, with different systems. So if you've got the same task happening in multiple systems, it can flag areas where you may have confusion on source of truth, and can also identify areas where you may find automation helpful. So if there's something that's happening over and over again that seems to be consistent across multiple workflows, so pieces of the registration process, things like that, then you may be able to sort of dive in and look at those as an optional or possible automation process. So the next one that I have identified is resequencing. So if you've got roles identified with steps and you've got them in a particular flow, and that's the logical flow that they take place from a time perspective, you can take a look and see if there are actions being performed by a role that could actually be performed more efficiently by another role, of course, making sure that the scope is in line. Or you can also visually see if there's a place that needs to be rearranged. So you've got, a couple of people jumping in and out, and perhaps they can get a few things done all at once up front and sort of save room on the back end. So it's easier to see that if you can actually look at it visually instead of just conceptually imagining it in your mind or having verbal conversations. Next up, we have communication. So this in particular is communication that involves patients or caregivers. So if you've got the patients and caregivers identified as actors in your documentation, and typically that's shown by a line above that is public facing or forward facing, it becomes easier to see and to understand how frequent the interaction is. So how often are we communicating with patients and family, and is that sufficient? So are we communicating at the right times? Are there a lot of things happening where we're actually not interacting with anybody that we maybe need to look at that? So it can give you an opportunity to understand, how frequently and how regularly those communication paths are happening, and whether you need to actually increase them, shift them around a little bit, sort of make some changes so that they are more consistent and more appropriate. And they can help you with patient satisfaction scores. So if you actually take a concerted effort to look and to include the patient and family in those workflow documents, it can be very eye-opening, and it can be very helpful. So the next one up is policy needs. So policy, organizational guidelines, things like that. So if you've got all of the steps in a clinical workflow clearly laid out, and you have all of the individuals, clinicians and administrators, support staff who are performing the roles, you can highlight areas where policies or documents that contain guideline information should be developed or need to be updated. So if you, one of the easiest ways to find this is if you're collaborating on either updating documentation or putting it together for the first time, and you notice that there is individuals making assumptions, or if, we think this is how it has to happen, it's a good place to take some time and check in and see if that is actually in fact correct, if the policy does reflect that. The other thing is if you're making adjustments to workflows and there is a policy or a guideline from the organization that is associated with the workflow, when you're doing that upkeep, you can actually go back and make sure they're in line. So you don't want your documented workflows and your policy documents or guideline documents, regulatory documents to be misaligned. Having them written down actually helps you keep those in sync. Next up is performance measurement. So one of the things that we're consistently looking for is ways to measure our KPIs, so our key performance indicators. How can we demonstrate that things are getting better over time? Are they getting better from an efficiency perspective, from a scope perspective, from an output perspective, or from a compliance perspective? So it is much easier to actually take those measurements and understand where you need to hone in on the process if the process is documented for you. If it isn't documented and we just know that between point A and point W, there's some problems, it's really hard to hone in on them if you don't have them written down and to sort of measure along the way and take sections that you can look at. So documenting workflows helps tremendously with those types of efforts. And last, but certainly not least, is change management. So organizational change management is huge for all hospital systems and healthcare organizations across the board. And one of the things that we tend to, as an industry, struggle with is communicating when a change is occurring. So, what actually is happening? What do I need to do differently? When do I need to do it differently? How am I going to do it differently? All of those things are a lot easier to communicate if you understand what is happening right now and what is going to happen in the future. So if you can actually see and pinpoint and articulate and define the difference in the concept of a flow that's understood by clinicians and administrators and support staff, it's a whole lot easier to manage your way through organizational change, because you can communicate, you can create documentation, and you can have that training and support material that actually does articulate, this is how it was, and this is how it's going to be in the future. You can make sure the policies align. So the change management piece is massive, and it is helped tremendously by having documented workflows. So I came across this quote when I was looking for things, which is, if you can't describe what you're doing as a process, you don't know what you're doing. Seems kind of harsh, but it actually does reflect quite well that as you're trying to describe and explain what you're doing for somebody, you should be able to write it down. And writing it down and being able to articulate it in a way that's easy to understand is something that we should all strive for. So I think that is the last slide. It is. So I have a couple more videos sort of in the next few months to talk about documenting workflows, another one that's coming up in just a few days. So stay tuned. If you want to be notified when the new one comes out, then hit the subscribe button and you will get a notification if you hit the bell as well. And I will see you next time.